I am Professor Dr. M. Wali, working at Sir Gangaram Hospital in the Department of Medicine as a senior consultant, and I have been serving 3 presidents of India, namely Mr. R. Venkataraman, Dr. Shankar Dayal Sharma, and Bharat Ratna, Dr. Pranab Mukherjee. Apart from that, I have worked in Ramanolo Hospital and GB Pant Hospital. Well, sudden cardiac death, if we see in the modern concept, today's concept has shown a paradigm shift which the health authorities have woken up due to that, and also our healthcare system is sensitized for that. And why this is happening in more numbers, this is to be considered. Post-COVID, we have seen more of it happening, more obesity coming, people under stress, smoking more, there is lack of sleep, there is post-COVID status in many of these things. So all the healthcare providers are familiarizing themselves for the need of the hour, how to upgrade our systems, how to evaluate, especially as you have asked, younger population. They are the future India and their problems have to be addressed. There are counseling sessions to be arranged, and also what is wrong with their diet should be emphasized. So all these things make our job more complex and more responsible, and it would be appropriate to discuss all the modalities on the World Heart Day. Smoking and stress, these are the factors which are encountered globally, and European countries are just ahead of the world, including United States as well. They have worked very hard on harm reduction on smoking. Last month we had a guest from Israel, Dr. Rowan, and Dr. Rowan emphasized and also shown some new strategies which the USA, Norway, Sweden and other European countries are adapting, and they have modified tobacco, and this is very exciting for youngsters who are to be stopped from hookah and cigarettes. So for them the available option was vaping. Now in addition to vaping, they have got 2 decent options. One of them is heated tobacco, which is tried well in European countries including Norway and Sweden, and the most importantly, they have come up with a version of tobacco which can be just kept like a tea bag behind the lip. Through the mucosa, it gives the effect of nicotine and is much less harmful to the tune of 20 to 80%, and this is called SNUS, S-N-U-S. This is a very exciting research in the field of modified tobacco for harm reduction due to tobacco and smoking especially, and this has shown very promising results, and I hope this will come in a big way as a substitute to the cigarettes. Yes, I was a part of the project about 10 years back, which ITC also took over with low tar cigarettes or low nicotine cigarettes. We had thin cigarettes or slim cigarettes in the past, but the recent innovation and production of a tobacco which is less harmful to the tune of 50% and is especially researched in India by the ICMR is also a topic of discussion for future, and this will also, I am sure, give very promising results. Exciting news was ICMR has come with a kind of tobacco which is already with harm reduction to the tune of 50%. But if we double the quantity of smoking, it would get neutralized. So best is to quit smoking, but this is a better way, like I told, slim cigarettes, low tar cigarettes. Cigarette itself is not harmful because only nicotine, but it has nearly 4,930 toxic ingredients which are bad for brain, bad for nerves, bad for heart, bad for lungs. So beware, cigarette is poison, cigarette is death. There are some pharmacological or pharmaceutical measures which in the past became very popular, like nicotine gum, very fashionable, but people used to eat more. It used to supply 4 milligram, people used to chew it many times. or patches, nicotine patches. They are all being misused, especially by younger population. What Sweden and Norway have come up with is smoked tobacco or heated tobacco and snus is a very good alternative. However, nicotine patches and gum of course is available, but patches are restricted on prescription. So, these are not the actual modalities. Actual modalities are washing of brain and learning the harm reduction and quitting by cold turkey method. And government is also doing in this direction by increasing tax on cigarettes, but how far it is effective we don't know yet. But I would say the better options are coming, so till then we have to stop smoking. Well, smoking is such an addiction that symbols can't make people choice weaker or they can't stop. I would say pictures, cartoons and warnings do help to some extent, but the very important step which the government of India has taken to ban the sale of tobacco products near the schools has done a great benefit. Now, as you say, packets warnings, the warning is to be in the heart and mind, not on the packet. And for that, important thing is counseling, giving time to the children by parents, and also educative classes in the school time and watch of the by the teachers to the students that children are not going for smoking, because it's a peer pressure through which the smoking starts. Doctors today have very important role, because usually patients, those who have lung diseases or especially when they have chest pain, heart attacks or post-operative patients come to us, I still find people are smoking. They are carefree about it because smoking has never been discussed. Occasionally I find the word smoker on the prescriptions. That's not enough. We have to sit down with the patient and explain why at all you are visiting a cardiologist, why at all you are having bypass surgery, why at all your coronary arteries got blocked. And in India this is happening 10 years ahead of the world, which is very sickening and very disastrous for the future of India, our young generation. So doctors have a very, very important role. We should employ special counselors in the cardiovascular departments, cardiac surgery departments, who should tell how to quit smoking, tobacco and adapt a healthy lifestyle. We do have some diet counselors or dietitians, that's not enough.